Boogaloo has removable dentures, and I'm just going to get you to open. Boogaloo has a partial denture, and I can tell because he has a little metal clasp that I'm going to use my finger ever so lightly just to lift and just very safely remove and have my hand over top so that we don't want to drop the denture. And I'm just going to put that on my tray. And with the top, again, and close a little, and I just sort of close a little bit just to get the suction or seal, just to get it off like so. Again, I'm always taking it out and holding it with my hand underneath to make sure that we don't drop it. You can relax.
Okay.
Good. Another trick you can do is ask a patient to blow their cheeks up like so, and it breaks the seal as well. I love how this denture is labeled. If we were to finish cleaning the dentures, I've just gone to the sink just with water and a denture brush, and I really scrub it actually. I really scrub the teeth surfaces on the outside around where the clasp is, and then if you flip a denture over, there's always plaque and bacteria all the way inside on the inside of it. So when we're putting it back into somebody's mouth, it's nice and clean. In terms of taking dentures out at night, we want to make sure that we're putting them in a very clean, changing solution. I just happen to have a sample of Polydent that our patients use. We give them samples to keep the dentures in the basin. If you don't have it, not to worry about it. You can just simply put straight up water. And putting the dentures back in, again, I would take the lower and just very gently pull the cheek a little bit apart. Put it back in, rest it using my fingers underneath, making sure, and it's comfortable. The same thing with the top. Again, I pull the cheek out a little bit just to get the space, put it back in, make sure my fingers are out of the way, and we're back where we started from. Thank you so much. Thank you so much.
You're nice.
Thank you. Barbara has an interesting condition where she can't have a lot of fluids, correct?
Right.
Correct. So can't drink waters or different things like that. So couple things for somebody like Barbara. If I was a nurse, personal support worker, caregiver, family member, one of the first things that's very important is to make sure you have all of your tools and props ready to go.
Right.
So I would have Barbara sitting up as she is. I would let her know that we're about to brush her teeth. We do the circular motion just to show that that's what we're going to be doing. Thank you. And then having the obvious things ready. The toothbrush, a little bit of toothpaste if we were using toothpaste with Barbara, 2 cups, one with a little bit of water and one just on the side that's empty just in case she needs to expectorate or spit at any time. 2 of the things that I always suggest for people to make it comfortable for themselves is to have safety glasses so they feel comfortable. So something along that line, just like you're wearing your safety glasses. And a mask if they also feel, just to protect them as well and to make sure we're not coughing in Barbara's mouth. For the purposes of this video, I won't use those tools. But because Barbara can't have any fluids, we would be using our specialized toothbrush or a regular toothbrush if that's what you have, and we would be dipping them in water. So I'm going to start with my favorite toothbrush, which is the Surround toothbrush. It actually matches your outfit quite lovely. And I would just dip it in the water to make sure that we have it nicely there. I would be putting on my gloves. If Barbara had just had a meal or there was excessive food, etc. in the mouth, having some gauze or some tissue available. And I would take the toothbrush, wonderful, she already knows. And I always love starting on the opposite side of where I am in terms of brushing the teeth there. You can take your time, not to rush things, and also make sure that you're letting the patient know what we're doing, etc. And we want to make sure as well that we protect her outfit. So I sometimes have paper towel as well ready in case she needs to spit or wipe anything off.
Thank you.
You're welcome. Thank you. And that kind of thing.
Yes.
And open again for me. And same thing with the top. We're using our specialized toothbrush. Just open for me, Barbara. Perfect. And it's really easy. I mean, patients love their teeth being brushed. It's clean and fresh. And I want to empower people, family members visiting, etc., nurses, caregivers, etc., anybody can easily be able to clean one another's mouth. I want to thank you, Barbara. And normally with any patient we normally do, Bill is right on his game, but we usually tend to just rub the cheek in a very circular fashion just to signal that we're about to do toothbrushing or cleaning one another's teeth. I personally would get Bill to open, perfect, and with a regular toothbrush I would be brushing the grinding surfaces. I would be going on the outside surfaces, and Bill's just such a treat, and on the inside surfaces. So, I mean, Bill is just fantastic to do that. I usually have all my tools ready. So if he needed to spit or expectorate, we have a cup there. Also, I like to have half a cup of water just ready in case he wants to rinse before, if it's just been lunchtime, anything along that line. In terms of toothpaste that we use, Bill has a G-tube, so swallowing is an issue. Yeah. So, right. So usually for patients like Bill, we will not recommend fluoride toothpaste or toothpaste in general. But if we were to use just a tiny little bit, we would be just using, you can kind of see, not even a pea size, but it's just extremely, extremely small. You can hardly see it.
I use more than that.
Yeah, you shouldn't.
Okay.
In terms of opening the mouth like so, I would just put my finger like so, just to get in on the top surfaces, brushing surfaces, etc. Now, Bill has been a patient at our clinic for 2 years, and so he's been privy to some pretty handy-dandy tricks we have to make it really easy. So for example, if Bill was not feeling so great, having a difficult day, I love these mouth props. They are a patented mouth prop called the Open Wide Grip, and they're spongy, they're antibacterial, and let's see here, bite together for me, Bill. Good. And this is a way, some nurses are afraid of the patient biting them or closing down on them inadvertently, so it allows me to brush the surfaces this way. Take it one step further, and I would use this very specialized toothbrush called the Surround toothbrush, because the bristles are on a 45-degree angle and allow me with one simple movement to brush just the grinding surfaces, but imagine it gets the outside surface of the teeth and the inside surface of the teeth just by the fancy-dancy creation of the bristles. Thank you so much, Bill.